Thank you for attending our presentation this afternoon. The presentation is on the GlideWear prosthetic liner patch and is sponsored by Tamarack Rehabilitation Technologies. Before we get started, we would like to introduce ourselves. Charlie Kuffel is the President and Clinical Director at Arise Orthotics and Prosthetics and is also a clinical consultant for Tamarack Rehabilitation Technologies. Jason Pawelski, myself, am the Sales and Marketing Manager at Tamarack Rehabilitation Technologies and have 8 years of experience in O&P product development, sales, and marketing. During the webinar today, we will discuss the skin care challenge faced by prosthetists and amputees. We'll introduce the concept of friction management and its role in wound care. We'll introduce the GlideWear prosthetic liner patch. Charlie will present case studies from his own experience using the GlideWear patch, and we will open up to a question and answer session. According to the Amputee Coalition, there are approximately 1.9 million amputees in the United States today, and over 65,000 lower limb amputations occur annually due to diabetes alone. The annual prosthetic liner utilization is estimated at over 200,000 units. So what does this mean? Skin integrity disruption is a constant struggle for the prosthetist and rising amputee population. It's not isolated by diagnosis, geography, liner, or device type. We broke down the impact of friction and shear on human soft tissue into 3 categories. You have your intrinsic factors, which would be your genetics, your general health, nutrition, age, neurosensory status, metabolic status, etc. These are factors that are largely uncontrollable. You also have global factors or environmental factors such as the patient's education, their motivation, their lifestyle, willingness to follow up with programs that their practitioner prescribes for them. These are also largely uncontrollable by the practitioner. Finally, you have your extrinsic factors. These are pressure, friction, and shear, and microclimate. These are factors that can be controlled through effective device fabrication and material selection and follow-up. Repetitive loading is a concept where the load is applied to the skin, reaches a maximum, and is released or reduced, and this occurs over and over and over again. Virtually all repetitive loading has a rub or friction component to it. And every ambulatory person has experience with repetitive loading. It may be just an irritant for Mr. Blue. It causes pain and discomfort for Miss Green and leads to serious injury for Mr. Red. Repetitive loading skin trauma places functional limitations on all 3 of these individuals and affects them and their activities of daily living in different ways. Let's examine what this looks like in a clinical case. Here's some pictures of different repetitive loading skin trauma and pressure-related skin breakdown. You have a couple of lower limb applications here, and some are due to knee brace, orthopedic knee brace, and some are amputee-related skin breakdown. And as you can see, some of these issues appear to be much worse than others, much more severe, and require different treatments. The conventional wisdom is that red skin equals pressure area, so we must reduce peak pressure, and that's the end of the story. Although pressure is a very important component in skin tissue trauma, we also want to remember that reducing pressure also decreases the clinical control that was originally desired, and it leads to a lost opportunity to enhance and extend function for that individual when you're trying to control their fit. And as a result, it's a very labor-intensive and costly return visit to the practitioner in order to correct what could have been prevented in the first case by incorporating friction management as the first line of defense. So in other words, pressure is always very important, but friction management can be introduced at the onset, and if effective, then you don't need to have those return office visits for correction of the device. This is a qualitative graph. On the vertical axis you see increasing skin trauma, and on the horizontal axis you see walking distance over time, which is equivalent to rub cycles. If you have a very high friction contact point in prosthesis or orthosis, you're going to reach the point of skin breakdown very early. If you're able to control that pressure and friction incidence, you might be able to double the amount of time that an individual is able to walk or go to work or participate in activities with family and friends. And if you incorporate friction management and are able to address those particular areas where you're having friction breakdown, you'll be able to extend your walking time and rub cycles significantly and potentially not even reach that point where you're going to have abrasion or blister formation or breakdown, or at least not until the very end of the activity in the day. How do we currently address friction and shear in the prosthesis? Skin lubricants such as lotions and gels are commonly used. However, there are some pitfalls. They're messy to apply. They're likely to spread beyond the targeted area, so rather than really managing friction, you're causing global reduction in friction and potential loss of control with the device. You're also hydrating the skin as that skin lubricant is absorbed, increasing the coefficient of friction between the skin and liner and making the skin even more susceptible to trauma. Also, the skin lubricants are just a short-term solution and they need frequent reapplication. An individual might think that they have a nice safety net from using these products, but as they are absorbed, that benefit is significantly reduced. Also, some liner manufacturers say that skin lubricants are contraindicated due to the risk of breakdown of the gel. So what is GlideWear? Some of you may have already heard about the product, done some research, you may have tried it on a patient. GlideWear is a patented dual-ply low-friction fabric technology. It was manufactured by Tamarack Rehabilitation Technologies at our office in Minneapolis, Minnesota. You may know Tamarack best as the manufacturer of the Tamarack flexor joint or shear band. GlideWear was first commercialized in 2009 for use in wheelchair cushion covers. That product is now licensed out to a company called the Comfort Company. And GlideWear, in its essence, is a comfortable, conformable, versatile, long-lasting, and highly effective shear management technology. Indications for using the GlideWear prosthetic liner patch are very broad, including nearly every amputee who experiences discomfort and skin breakdown from their prosthetic liner or socket. Critical sites of breakdown include the patella, popliteal, distal anterior tibia, and fibular head. In addition, the GlideWear patch is also recommended as a tool to prevent premature liner breakdown. If you're seeing patients that are breaking down their liners frequently, it's very likely that that's an area of significant friction, and the GlideWear prosthetic liner patch will help not only remove that offending friction, but also extend the life of your very expensive liner. Features of the GlideWear prosthetic liner patch: it's very easy to use, comes in 2 sizes. You simply place the appropriately sized GlideWear patch over the targeted area before rolling the liner over the top. The GlideWear prosthetic liner patch provides targeted shear reduction. Shearing occurs between the dual-ply GlideWear fabric, not against the skin, and the friction shear reduction is only at the intended point within the prosthesis or orthosis. The product is very durable. It was manufactured to be reused daily and laundered frequently as needed for months of worry-free skin protection. The product has only been available since September, but internal testing has revealed through 100 wash and dry cycles and 180,000 rub cycles that the GlideWear material does not break down from wear and washing very easily and is not a disposable solution. It's intended to be a long-term solution. One point we want to make about the product is that you never want to apply the GlideWear prosthetic liner patch directly over open wounds. It is not a sterile wound dressing, and we always recommend that proper wound cleansing and protection and coverage be incorporated into the healing of existing wounds. Benefits of the GlideWear prosthetic liner patch for the amputee: they notice immediate improvement in comfort, a better wound healing environment because you're supporting wound healing by eliminating that offending friction and shear. We eliminate the need for messy and ineffectual creams and powders. As previously mentioned, we also protect the liners from early wear out. And the amputee is able to enjoy months of daily use with just a single patch, which makes it a very cost-effective solution. For the practitioner, you finally have a solution for the most difficult skin trauma cases where you're having chronic breakdown over time and not able to properly address the issue with typical solutions. You also require less extensive socket recontouring, which results in better fit and function of the device. You have a significant reduction of early returns due to nagging skin problems. This also reduces practitioner time on non-billable facility expenses and no reimbursement battles to deal with, which is especially critical at this point in our industry. Moving on to what I touched base on briefly before, the GlideWear prosthetic liner patch is incredibly easy to use. You simply position the patch over the affected area. Generally, it's an area of redness or soreness or breakdown. Roll the liner over the top of the patch, and it completes the placement. The prosthetic liner, regardless of what material or gel that it's made from, holds the patch in place and keeps it from migrating. And we recommend that you use a clean and dry patch daily to ensure lasting protection. And the patches should be laundered as needed, either hand wash or machine wash. We don't have any specific instructions. Now we have a patient testimonial with application video that we'd like to show you. There we go.
My prosthetic provider, Kevin Hines, suggested trying GlideWear on my knees to keep them from the soreness and bleeding. I've tried it now for 4 weeks. My sores have healed. My legs feel great. No problems walking. It was A+.
GlideWear prosthetic liner patch is available in 2 size options. The small patch is 2.5 inches by 4.75 inches and is suitable for most users. In the 3 months since the product was introduced, actually about 60% of the patches sold have been small, 40% large. The large patches are 4.5 inches by 7.5 inches and are ideal when a larger coverage area is desired. The small patch has a $27 MSRP, and the large patch has a $34 MSRP. And the product is sold 2 patches of the same size patches per pack. And if you're interested in the breakdown of the pricing for clinics, we recommend that you contact your distributor. Now, I'll hand it over to Charlie, and he'll discuss a number of case presentations where Rise Orthotics and Prosthetics has detailed healing of wounds over time using the GlideWear prosthetic liner patch.
Thank you, Jason. A couple things that I want to point out clinically is Jason alluded to the fact that oftentimes as clinicians, if we see areas of redness and or irritation, historically our first thought has been to ablate the material, whether we either grind out the socket or a heat flare in AFO to relieve the high pressure areas. That's very time consuming, it's very costly, we potentially jeopardize the integrity of the orthosis or the prosthesis. And more importantly, we jeopardize the biomechanical principles we set forth initially. What I have done over the past probably 8 to 10 years is my first line of defense is to address friction and or skin-related shear. The reason is, in particular, say an AFO or a prosthesis, if the liner isn't on tight enough or they're getting some pull on a liner or a strap on an instep of an AFO isn't tight enough, during the dynamic motion that we all encounter during orthotic or prosthetic wear, that motion causes skin breakdown, which leads to the issues that Jason has observed. So really my first line of defense is to look at the friction-related component versus the direct pressure-related component. When you heat flare an item, it's much more difficult to rectify a convexity than a concavity. We can always push it out, but once it's pushed out, it's too hard to push that back in, necessitating refabrication of orthosis. Or prosthesis. The other thing Jason alluded to was looking at widening the margin of safety of our prosthetic users. Currently we have a multitude of new componentry on the market which are designed to increase the ability for amputees to function. If we have inner socket issues, which is common not only in the United States but really globally, if we have inner socket issues, no matter what type of componentry we put on below that socket, we really minimize and limit an amputee's ability to function to their greatest potential. So with the GlideWear prosthetic liner patch, I've been utilizing this product in a beta test form and the final form for about 18 months now, and have really had truly remarkable success with this. It's one of the issues we would see patients for recurrent where they would put a sheath underneath the liner which would jeopardize the kind of the stiction of the liner and would jeopardize the fit. We would try the lotions. The lotions allow that liner to slide off the limb, which elongates the prosthesis during the swing phase of the gait cycle. So we started to utilize the GlideWear prosthetic liner patch so we can spot reduce areas of really that stiction between the liner and the skin during dynamic motion. If we look at the first case study, this was a gentleman, a 57-year-old below the knee amputee. He's a left transtibial, very active gentleman. Post Charcot changes of that left foot, amputated that limb, continues to have right Charcot deformity, where it's a double upright unweighting AFO on his contralateral side. Very active gentleman, climbs a lot of ladders, does a lot of audiovisual work, so he's up and down ladders, he's on and off of his knees, and had really developed a number of kind of lesions and skin issues on the lateral anterior musculature. We fought this, my business partner Kevin Hines and I fought this area of irritation for a number of months, started to utilize the GlideWear patch about 816, 820 right in that area, and by 924 we resolved all those issues. One of the things we see in clinical practice that when patients have lesions or areas of drainage, the thought process is to add a bandage over that area, which spot increases the amount of pressure there. So although that bandage may absorb drainage, what it does, it increases the direct pressure over that area, ultimately resulting in increase in wounds. With the GlideWear liner patch, we have a thin enough layer so we're reducing that coefficient of friction in those specific spots while decreasing the bulk over that ulcerative area. So through this, really the summation from 816 to 924, we were able to resolve that. He's still a full-time user of the GlideWear prosthetic liner patch, more prophylactically. We don't want to cause further issues. He's recognized the efficacy of this, and his ability to function for longer periods of time with fewer complications. If we look at the second case, a 50-year-old female below the knee amputee, currently in a suction or in a cushioning liner with suction suspension, fair amount of adherent tissue. That adherent tissue, as we all know, doesn't have the same elasticity as normal tissue. So during that pull, push, flexion, extension motion that we all encounter 5,000 to 7,000 times a day during normal ambulation, that skin will tend to tear open and tend to cause areas of high pressure and really complications for prosthetists. 2013 of this past year, she developed significant, really debilitating ulceration just distal to her patella. We kind of ran out of issues. She's tall and she has a very short residual limb. We applied the prosthetic liner patch, and really over the course of the next 4 months, we were able to resolve that, and we just saw her late last week, and she remains resolved, remains a full-time wearer of the liner patch. And we'll go on to our last case study, our second to last case study. Again, just another transtibial. The areas we tend to see issues on for transtibial are patella, fibular head, and distal anterior tibia. Again, when liners are fabricated, they're fabricated in a linear fashion, so they're fabricated straight up and down. As we sit, stand, flex, extend, we tend to see pulling and pushing over these areas, these bony prominences. So by applying the GlideWear prosthetic liner patch, we can spot reduce those areas to allow the liner to create a functional cushion while relieving the stiction around these bony landmarks. So again, about 6 weeks after wearing this device from the anterior distal tib, we were able to resolve this. And again, this is another gentleman who remains a full-time user, but more prophylactically. We don't want to create issues with this. He understands the need for this type of really simplistic management. In our last case, this is not only resolved for prosthetic cases. This last case is a gentleman who was involved in a car accident, had medial knee compartment osteoarthritis, has had significant surgical interventions. He's currently on morphine and other issues to address the pain. We had to create such a severe directed force to offload his medial condyle that we started to develop irritation on the condyles themselves. So we took a prosthetic liner patch. We had it fabricated in an oval, so it would slide over the condylar pad on an OA knee brace. This gentleman continues to wear that full time, and because he goes through that flexion and extension cycle during normal ambulation, we can reduce the coefficient of friction right over that directed force. So not only is this kind of technology applicable to the prosthetic patient, both transtibial, transfemoral, but as well as the orthotic patient who has to wear a device that has high coefficient of friction because we're trying to correct a bony abnormality. And that's all I have for the case studies. And I'll let Jason finish this up.
Just a few tips that were mentioned earlier in the presentation, but we just want to reiterate that GlideWear is never indicated for placement directly against an open wound. You always want to properly clean and protect an existing wound before putting the GlideWear patch over the top to help support wound healing and prevent further trauma. Incorporating the GlideWear patch into daily wound cleansing and coverage, I talked about that a little bit, will reduce and eliminate pain and support faster wound healing. In addition, I just want to mention that to avoid recurrence of skin breakdown after healing, amputees want to continue using the GlideWear prosthetic liner patch. If you've had an issue and you're able to resolve it with friction management, you don't want to stop using that intervention, whether it be GlideWear or shear band or whatever, because you're going to see recurrence of that breakdown. If it works, it should be used ongoing whenever you apply your liner and prosthesis daily. And we recommend that amputees have a handful of patches that they can exchange daily so that they always have a clean and dry patch available to them. Now we want to open up to questions. If you have any questions about the GlideWear prosthetic liner patch specifically, or the case study results presented by Charlie, we would like to hear from you, so please type in your comments and we will present them.
And while we're waiting for any questions, as a clinical prosthetist, one of the things I keep kind of in my toolbox of management are shear band as well as GlideWear patches. And one of the big reasons is the simplicity. I see a lot of patients in their home environments, and if it is a skin integrity issue, the first thing I will do is apply either a GlideWear prosthetic liner patch, or I will apply a shear band patch inside that socket. What that does, it prevents me from having to go back to the office. It simplifies the solution on site. When it works, that's just an ongoing treatment that we utilize from there on out. And that's one of the important things. While our clinical time becomes much more important because we're spending more time fighting the administrative battles, the simplistic application of things to prevent problems makes our lives, or my life in general, so much easier. And I found that this product, as well as shear band, has really helped me to be a better clinician and to really get better outcomes, necessitating fewer return visits, again, which Jason alluded to, tend to be costly.
It doesn't look like there are any questions, but if we were unable to see your question, please do email me or give me a call. And again, my email address is on the screen, but you can email me anytime at jasonp@tamarachti.com, or call toll free at our 1-800 number that's on the screen, or our local number. We really appreciate you attending our presentation today. And if you would like a recap of the presentation or would like to share it with anybody, it will be posted on our website shortly at glidewear.com/PLP. Thank you again.